If you are taking Metoprolol, Atenolol, Bisoprolol, or Carvedilol for your blood pressure or your heart, I need you to watch this before you take your next dose. These are some of the most commonly prescribed medications in America. Millions of seniors take them every single day. And just like with Amlodipine and Lisinopril, there are things happening in your body on these medications that your doctor may not have had time to fully explain to you. Side effects that are being blamed on aging, energy changes that are being dismissed as just getting older, and one danger with this specific class of medication that almost nobody warns patients about until it is too late. That last one is the most important thing in this video. Stay until the end. I have been working with older adults in clinical practice for over 10 years, and this conversation comes up constantly because beta blockers, which is what all 4 of these medications are, affect the body in ways that go far beyond just slowing the heart rate and lowering blood pressure. Today, I am walking you through what you actually need to know. Plain language, real information, no complicated terms. If you have not subscribed yet, please do that right now. 2 seconds. Thank you. Now, let us start with what these medications actually do, because once you understand the mechanism, everything else makes sense. Metoprolol, Atenolol, Bisoprolol, and Carvedilol all belong to the same family called beta blockers. They work by blocking the effect of adrenaline on your heart, slowing it down, reducing force, dropping blood pressure. For people with high blood pressure, heart failure, or a history of heart attack, these medications have saved millions of lives. That is real, and it matters. But that same mechanism, blocking adrenaline, also affects other systems in your body. Your muscles use that signal. Your metabolism uses it. Your circulation to your hands and feet uses it. When those signals get blocked along with the ones going to your heart, the effects show up in ways most patients never connect to the pill on their nightstand. The first thing most people on beta blockers notice, and almost always blame on something else, is that their energy feels different, heavier. A low-grade flatness that does not go away even after a good rest. This is real, and it is documented. A study published in PMC examining patients with heart failure on beta blockers found that fatigue, bradycardia, and low blood pressure were noted as side effects in 32.5% of patients. That is roughly 1 in 3 lose their warmth. A systematic review published in the British Journal of Clinical Pharmacology found that beta blocker use was the most common cause of secondary Raynaud's phenomenon, a condition involving cold, pale, sometimes painful fingers and toes, identified in the Framingham Heart Study, accounting for 34.2% of secondary cases. If the cold hands and feet started or got significantly worse after you began a beta blocker, the medication is almost certainly involved. Beta blockers, Metoprolol and Atenolol specifically, can cause weight gain. Slow, frustrating, 2 to 5 pounds that the scale holds onto despite your usual habits. Mayo Clinic confirms that older beta blockers are more likely to cause this than newer ones like Carvedilol and Nebivolol. It affects roughly 10 to 20% of users. Beta blockers slow metabolism slightly and reduce energy, less movement, fewer calories burned. Add those together over months and the scale quietly rises. If you have been on Metoprolol or Atenolol and your weight has crept up in a way that does not respond to your usual habits, raise it with your doctor. Not to stop the medication, but to ask whether a newer beta blocker might be more appropriate. Here is something almost nobody tells patients when they first start a beta blocker. These medications can cross into the brain. Metoprolol in particular is what researchers call lipophilic, meaning it dissolves in fat and can pass through the barrier that normally protects the brain from most medications in the bloodstream. A case report published in PMC documented metoprolol-associated central nervous system effects, including sleep disturbances, vivid and bizarre dreams, and in some cases, confusion and visual symptoms. A published review noted that the prevalence of depression and anxiety in patients on beta blockers with heart conditions ranges from 10 to 60%. Most of these patients do not connect their sleep problems or mood changes to their blood pressure medication. They assume it is stress. They assume it is their age. The medication Metoprolol's monograph on Metoprolol at NCBI specifically lists abnormal dreams, dry mouth, blurred vision, and mood changes as documented side effects. Atenolol does not penetrate the brain as readily. One reason some doctors prefer it over Metoprolol in seniors who report sleep disturbances. If your sleep changed, your mood changed, or you are having unusual dreams since starting Metoprolol, that is a conversation worth having with your prescriber. Now, here is the most important thing in this video, and this is the part I promised to tell you at the beginning. Never stop a beta blocker suddenly, not for a single day, not because you feel fine, not because you read something online. Never. This is not an overstatement. When you take a beta blocker for weeks or months, your body adjusts. Your heart and blood vessels develop what researchers call upregulation. They grow extra adrenaline receptors to compensate for the ones being blocked by the medication. When the medication is suddenly removed, those extra receptors are all suddenly exposed to your natural adrenaline at full force. The result can be a dangerous rebound, heart rate spikes, blood pressure surges, chest pain, and in people with heart disease, a real risk of heart attack. Clinical prescribing guidelines document that sudden withdrawal has been associated with worsening chest pain and dangerous heart rhythm problems. Any decision to stop must be done gradually over 1 to 2 weeks, with your doctor supervising every step. This warning applies to every beta blocker on this list. Metoprolol, Atenolol, Bisoprolol, Carvedilol, all of them. If you have ever run out of your prescription and skipped a few days, or stopped because you felt better, or decided to try going without, please call your doctor today and let them know. This is a serious safety issue that most patients have never been explicitly warned about. Beta blockers, including Metoprolol, Atenolol, and Bisoprolol, have been shown to interfere with your body's ability to use and produce coenzyme Q10, CoQ10, a molecule that every cell in your body uses to generate energy. Research published with PMID 17892 and PMC 4112525 confirms that beta blockers can deplete CoQ10, and that this depletion may be responsible for some of the fatigue and energy side effects most patients experience. In one study, CoQ10 supplements reduced side effects caused by beta blocker use. If you are on a beta blocker and you are struggling with energy, ask your doctor about CoQ10. The doctor's best brand at Walmart, Costco, and Target, the same one I mentioned in the Amlodipine and Losartan video, is a widely available, well-studied option. Discuss it with your doctor before adding it, particularly if you are also on blood thinners or other heart medications. First, if you are on Metoprolol or Atenolol and experiencing significant fatigue, weight gain, sleep problems, or cold hands and feet, ask whether a newer beta blocker like Carvedilol or Nebivolol might be appropriate. Newer beta blockers have a different profile and in many patients cause fewer of these side effects. The medication is not the only option. The specific one you are on may not be the best fit for you. Second, ask about home blood pressure monitoring. An Omron monitor at Walmart, Costco, or CVS for around $50 gives your doctor a far more accurate picture than a single office reading. Many seniors read higher in the office simply from the stress of being there, and that one number can drive unnecessary dose increases. Third, and most important, if you have ever stopped your beta blocker suddenly, or if you are thinking about stopping it, tell your doctor today. Not next month, today. The rebound risk is real, it is documented, and your doctor needs to know so they can taper you safely if stopping is the right decision for your situation. I want to close with a patient. His name is Gerald, 73, a retired high school principal from Phoenix, Arizona. He had been on Metoprolol for 4 years. He came to me because he had gained 8 pounds since starting the medication. His hands were cold all winter. He was having vivid and disturbing dreams almost every night, and he felt, in his words, like someone had turned down the volume on his entire life. He had mentioned the dreams to a previous doctor and was told it was stress. He mentioned the cold hands and was told it was age. Nobody connected any of it to Metoprolol. We worked with his cardiologist to switch him carefully to Carvedilol over 3 weeks. His sleep improved in the first week. His hands warmed up within a month. 3 months later, 4 pounds were gone without any change in his diet. He told me, "I feel like myself again. I did not even realize how not myself I had been until it went away." The medication may be necessary. The specific one you are on, at the specific dose, may not be. Drop this in the comments. Which beta blocker are you taking, and how long have you been on it? I want to know what people are working with. I read every single one. Share this with someone over 60 who takes a blood pressure medication every day and has been dismissing symptoms they cannot explain. This information could change the conversation at their next doctor's visit. This is Dr. Daniel Harres. Take care of that heart. It has been working for you every second of your life. Time to work for it.